All right, so we put on our gloves, again, identified the patient and explained. So I'm gonna go ahead and also put the linen saving pad underneath the patient's hand. So I'm going to apply my tourniquet again. Making sure that we're good. Oh, what I'm going to do first, because I didn't do it, but I'm going to prime my tubing here really quick. Filling this, squeezing it gently, filling it about halfway. And then I'm going to open my roller clamp. And fill my tubing. Bleeding the air out, so we're good there. Okay, and again, not making sure to not touch the end of that to anything. Okay, so now we're ready to go ahead and clean our patient, and we're going to start in a circular motion out. And then we're going to do that again and allowing it to air dry. While that's drying, just going to get a couple things ready here. Wee. And then with the needle too, I'm going to just carefully loosen, I don't know if you can see, so that when I slide the catheter in, I can easily slide that off. All right, so then I'm going to, again, palpate, find, make sure, and with the bevel side up, I'm going to apply pressure and pull towards me and enter at about a 30 to 45 degree angle, either on the top or to the side of the vein, and push in. As soon as you have flash, you would then release the catheter and the needle and gently push in the catheter the rest of the way. And before removing the needle, we're going to make sure to stop at the end of the catheter in the vein to make sure that the blood doesn't come out. And we're going to safety the needle and put it in our sharps container. Then I'm going to take my intermittent lock. Oh, and I'm going to put it on while stabilizing, being careful not to pull up on this for the comfort of the patient. And I'm going to apply my solution, my saline, and gently flush about 5 milliliters, slowly and gently. Into the patient, making sure that we have a good stick. We don't want, if it's not, we don't want phlebitis or infiltration to take place or excessive bleeding, so we're kind of flushing and watching for all of that. If we're good, then we're going to go ahead and connect our saline here. You know what, the other thing I would do first though, oh no, I'm good. Okay. If we had touched or contaminated either end, we would clean it with alcohol. This one we have not, so we are good. All right, now that we are good with that, we're going to go ahead and do a hitch Again, being careful not to twist and pull on the IV to hold it in place there. Once we have that, we're also going to place the pad, fold it up underneath for comfort of the patient. And prior, we're going to clean the area before we put on our dressing. The dressing, you want to make sure that it is clear so that you can see the site on the dressing. We're going to put the date, my initials, and the time and the on it. Making sure not to cover up the whole port. Let me grab another one real quick. So again, we're going to date and time and initial it and the patient. And the gauge of the needle as well on there. And we're going to place it on, making sure not to cover, good grief, the port of the, not to cover the port of the needle, so that if we needed to change it, we certainly could do that. Then afterwards, we're going to document everything. We're also going to check the flow here. So let's, and per calculations, it needs to be about 7 drops every 15 seconds. Just stop it.